Through its research and convenings, the Center on Philanthropy and Public Policy seeks to make philanthropy more impactful today and to create a smarter, stronger sector for tomorrow.
15 years ago, there was, and there still is, a great need in the field of philanthropy to provide foundations and corporations and individuals with well-researched information. "15 years ago, one of the first things that we began to study at the center was the tremendous shift in philanthropy that was happening geographically, but was also happening in multi-generational ways. And the shift that has occurred over that period of time has had a great influence on philanthropy, so much so that we have continued to study. Here we sit today with Barbara Bush, the third or more generation of a family dedicated to public service.
Before you got involved in global health, what hooked you to be so involved in the nonprofit sector in the first place? Because you've been there for a long time.
I never thought that I was going to work in global health. It was sort of an accident that I even got interested in global health issues, and it was really all through exposure. My parents were going to travel to East and Southern Africa, and they offered for me to join them. And the trip that they were going on was for the launch of PEPFAR, which is the President's Emergency Plan for AIDS Relief. And this is a huge, really incredible U.S. Policy program that would provide free access to drugs for people that were HIV positive living in developing countries. For me, just the stark inequity of where you were born and how much that shaped what your future could look like really blew me away. And I was a very idealistic 20-year-old and was really impressed that I was meeting people every single day who were trying to change this, who were launching a program that was unbelievably audacious. Now there's 30 million people living on antiretroviral drugs because of this program. Our inspiration actually was an organization that doesn't work on health issues. We had all graduated from college recently, and we had all seen our friends apply to Teach for America. When I graduated from college, 25% of my class applied to Teach for America. And we wondered if you could use that model, but apply it to another field that needs great talent, that needs more people bringing new solutions to the field. And first of all, everyone that we met with validated the fact that yes, you need really great people, you need really good talent to support programs and build programs, or you'll never truly see the change that you want to see. Different nonprofit organizations said, I completely agree with this. We need more talent on our team. We'll partner with organizations and they identify gaps that they have, and then we recruit exceptional young leaders who are up to age 30 to work for them for a year. We have 52 nonprofit partners that range from Elizabeth Glaser Pediatric AIDS Foundation to CARE to the Ministry of Health in every country where we work. And they take Global Health Corps Fellows on for a year because they are looking for more talent to help them fill gaps that they have so they can serve more people. What we're most excited about is the impact our fellows have in this year, but also where they end up afterwards, where they can really have much more influence to move the needle on solving health challenges. And I think the best part is end up in systems where they have 450 other people that they know really well from Global Health Corps who have a shared vision for what health equity could look like. We really want to change the perception around global health issues. We can truly solve a lot of the health issues that exist, but I think it's important for people to realize that they are solvable and to get engaged in whatever way they can.
We invite you to join our effort as we continue to shape the field of philanthropy.